have an integrated approach and use the analogy of building a house. Can you elaborate on that?
Sure. I use the analogy a lot because most people don't understand what exactly is an implant. What is this that I'm talking about? And is an implant a tooth? Is an implant a bridge? And they get confused sometimes. But I like to say an implant is an artificial root. And that's all that the implant is. The rest is the crown or whatever you build, simply exactly like you would on your tooth. Now, with the analogy for a building, we talk about the implant being the foundation. Those are the posts that you put into the ground, etc. The pillars, whatever, that you never see after the building's built. And whatever else is the structure that needs to be built on top of that. In this case, the crown, the bridges, the all your teeth is constructed on top of that. But it wouldn't be possible without the foundation. So implants are the foundation. The rest of the structure is actually your teeth.
Why is the foundation important in terms of the placement of dental implants?
The foundation is very important because essentially what we're trying to do is build the ideal structure on top of that. If forces should be centered, should be balanced, etc. So when a patient is chewing on the final product, those forces should be directed ideally down the long axis of the implant, and the implant itself should be sitting within the best volume of bone that we have in that area. So therefore everything's very well supported, and it would give us the strongest possible end result.
Why is your integrated approach beneficial to patients?
An integrated approach, in my opinion, is very beneficial, and that's why I got into all the different phases of implants. The challenge we had earlier was where one person was placing the implant and a second person was restoring it, for example, would be that a surgeon, the person placing the implant, would simply place the implant in the middle of the bone and would not necessarily align it with the best possible alignment for the structure that had to be built on top of it later. These days we almost use sort of a backwards approach where we look at exactly where we want the crown to be, and therefore we place the implant directly underneath that. So back to the analogy of a building, we decide exactly what building we want, and then we place the implants. Okay, it wouldn't make any sense to show somebody an open lot and say, "Put some pillars up there for me. I want to build a house." The person can put pillars all over the place, but without having an idea of what the house was supposed to look like those pillars would not necessarily be in the ideal place, and that sometimes used to happen within dentistry, where the surgeon would place it and said, "That's the best bone I had there," but the restoring dentist was go, "Well, that I can't place a tooth there. It would look completely unnatural. It wouldn't look good, or it wouldn't function well in the end."
So, in other words, the most efficient and effective way is to have a totally integrated approach where all decisions are made by one person.
It's essentially working from the same plan. It's basically having, going back to our building analogy, so we're the architect. We can determine the exact design and structure of the building, and we can place the ideal foundation underneath it. And we have control of all aspects of it, so that there isn't any miscommunication or any differences of opinion as to where it should be. We can place it in the ideal position because we know what the final result is going to be, because we've already decided on that with the patient. We don't place the implant and says, "Okay, go see what you can build on top of this." We've already decided from the end what have we decided to restore. Once we've decided on that, therefore we place the ideal and appropriate implant in the ideal and appropriate position.